inject platelet-rich stroma or PRS into the knee joint. We have already prepared the PRS, and the PRS is going to be injected under ultrasound guidance. So this is the ultrasound machine, and we will be scanning the leg with this probe. This is a linear probe, 12 megahertz frequency. Again has been set to the correct degree, and the focal points have been set to 1. You can see that yellow one there. I will be scanning the knee with this ultrasound probe, removing the effusion into the knee joint. There is an effusion in the knee joint, and we will be removing that effusion. I'll be showing you the effusion. I'll be removing the effusion by inserting a needle under ultrasound guidance, and then inject the platelet-rich stroma into the knee through the same needle. So now I'm going to take some gel over the probe. This is sterile gel. So the whole procedure is done under aseptic precautions. So this is the side of the probe, which is to the outside, and I am now bending the knee and placing the probe. So you see that black area? That is the area of the effusion, and the needle will come from here, from outside, and it will go into the area of the effusion. So I am injecting local anesthesia into the outside of the leg. Madam, are you playing here?
No.
Look at it. Look at it. Sweet over look at it. The fluid has been drained out. You can see the needle there. All the fluid has been aspirated. The needle is now confoundedly inside the knee joint. I am removing the ultrasound probe. So this is the fluid which has been drained out. This is the PRS solution. I am going to inject it now. The needle is already inside. Done. Procedure over.